Welcome to the Early Show with Latha Srinivasan. Today we're going to be talking about mental health, which I think is very important. Of course, recently Bollywood actor Sushant Singh Rajput committed suicide, and everybody started talking about mental health. But this has been a serious issue in India for the last decade, I think, and been ignored to a great extent because of the stigma attached to it. And today I have Dr. Natasha Kate from Messina Hospital. She's an award-winning, internationally qualified psychiatrist, and it's a pleasure to have you chatting with me about this today. Thank you so much.
Thank you, Latha. Nice to be here and a great opportunity to talk about something that's really important.
Yeah. As I was saying, Dr. Kate, again, because of celebrities, we start talking about mental health, whether it was, Deepika Padukone who spoke about depression and so on and so forth. But it's not just celebrities who are affected by it. The common man, everyday people, including kids, are affected by it. And yet we're not, spending as much time talking about it. Why do you think mental health is a very important issue which needs to be addressed today in India?
I think the first part of the answer takes from what you've been talking about. Because there has been an unfortunate event associated with a celebrity doesn't mean that mental health issues did not exist before that. If you look at statistics and data published by the government of India, you're looking at around 14 to 15% of people at any point of time have got mental health problems. So if you're staying in a society with around 25, 26 flats, you're looking at around 15 people having mental health problems, and of them half would have depression or anxiety. So this problem exists whether we talk about it or not. It's also important because this is a silent suffering population, because they can't talk about it, because they don't know how to seek help, because this is something we don't discuss. If you have a fever, you know whom to go to. But if you have a mental health concern, first to acknowledge that you have a mental health concern, we don't have the awareness for it. And part two is, whom do you go to? Who do you reach out to? We don't know that either. So this silent group of people tend to suffer over extended periods of time, and that kind of makes the problem more chronic and difficult to handle.
Right. Now, this lockdown has kind of aggravated a lot of mental health issues. What could have been in the initial stages because of the social isolation and social distancing and the ability to not interact with, friends and family. A lot of people are not able to cope. Do you think there are some coping strategies that could help regular people at this time?
Right. So I think the conversation has been heavily directed towards loneliness, while keeping a concept called solitude, the ekant concept that is there and as part of our culture has been put aside. The lockdown has given some people the opportunity to connect with their hobbies, with their own mental space, to bring in a better work-life balance, while for others, they have gone to the other extreme. One part of the problem is also the use of social media during the lockdown. So I think a lot of people who keep endlessly scrolling through negative news have been much more affected as for people versus people who put in their times and energies into positive things. Electronic media helps us keep socially connected while maintaining social distance, and we need to learn to use it the right way. So cope by first focusing on what you can control and what not on what you cannot control. Build in positive strategies for your mental health, including hobbies, including a social network, and bring in healthy health practices like exercise, yoga, meditation. Start off now. Don't wait until you have a problem for that to happen.
Right. I think that is very important what you said. Some people are doing it naturally, but others don't know which direction to go in.
Yes.
Yes. One of the things that people, hardly do, and only I think youngsters, especially millennials, are doing it more, is therapy. They're actively seeking therapy. Now, I also had anxiety issues, and I did go, for some therapeutic sessions. So, what do you think are the benefits of therapy? I mean, there's no, the negativity around it should go firstly. That's what I feel.
Of course.
But there are numerous benefits which people don't realize. Could you just elucidate on that?
I think the biggest misconception is therapy is talking to someone. And you do talk to your friends and you do talk to your family. And there is also this concept in Indian society that ghar ki baat bahar nahi batana. You don't tell your problems to other people. You kind of keep a good face, so to speak. And therapy kind of works against that social construct. But what therapy is not talking and chatting that you do with a friend over a cup of tea. Therapy focuses on certain thought processes, for certain anxieties, certain fears, guides you to deal with them, And in fact, it's like a skill you develop over time, which you can utilize in other areas of your life. Therapy, especially in the earlier stages of mental health problems, is extremely useful. And rather than just medications or looking at things like that, therapy plays a fantastic role. So I think being more open and honest about it is fantastic. It has become fashionable in the West to say, oh, I'm going for therapy. And I don't want it to be a part of fashion, but I want it to be a part of honesty, saying, okay, it's all right. We need help. We like need a coach if you want to run a marathon. Needing a therapist is no big deal.
Right. But going to a psychiatrist, that there's a lot of social stigma attached to that, right? People immediately say, "Oh, I'm not crazy," pagal hai wo.
Right.
Those kind of statements that come out. But there are benefits to medication,
Right.
for some people, obviously, not for everybody.
Yes.
How do you think we can combat this stigma? Because society, is the root cause for it. Society, causes issues for people, and then they also, the reverse effect of it,
Prevents them from getting help.
getting therapy as well. So,
I think with medication, first part of it is, I think, what is a responsibility that psychiatrists have. I think for a long time, doctors, and not just psychiatrists alone, had a very authoritarian approach. I'm going to tell you what you're going to take, and that's that.
right.
Secondly, there was a point of time where psychiatric medications were heavily sedative. They caused a lot of weight gain and side effects. But that was around 30 years in the past. But that legacy and that stigma, I think, has followed psychiatry and psychiatric medications through. I think it's important, and that's what I encourage my patients to do, is have a conversation. Some people would require medication to sleep. Some people sleep far too much and would rather have a little more stimulating medication. Weight gain is a concern, let me know. So I think it's a discussion between the person as well as the doctor that kind of gets it right. At the same point of time, involving family members, having these conversations early on and dispelling things like it's addictive, you start medications one time and you'll have to take it for the rest of your life. All of these are very old concepts which I think slowly are inching out. But I think as psychiatrists, we also have a responsibility to do more, and people should also talk more, ask more questions to feel more comfortable with what's happening.
Yeah, I agree with you on that, because a lot of people don't ask questions,
Right.
They just, doctor ne kaha hai, and therefore they do it. But they need to also understand what they're going through, what the medications are about. And I think it's a two-way process, which you rightly said.
Yes.
But one of the things that I found, because I've gone to therapy and I do know therapists, and people seeking therapy, is that the cost of therapy, versus the cost of medication, is much higher, and not everybody can afford it. So affordability then again becomes an issue, right? Is there some way around this where they can get benefits, but they don't have to spend so much? I mean, is there some way around it at all?
So I think what has happened is, as online therapy has become more common, costs are beginning to come down. I think a lot of people are also now beginning to work on group therapy, and this has all come in. I think this is the silver lining of the COVID pandemic. I think this has all received a little bit of an impetus. Some of my patients who have really got difficulties in accessing therapy because of logistics and costs, even things like, for example, a course on CBT that's available on Udemy. I'm not trying to advertise any forum. I'm saying that there are a lot of self-help guides available that form like a therapeutic network. Of course, if you think that these issues are not adequate for you and you need to step it up, you can look at that. Government hospitals are the second option that is there. Therapy in them is, in some places is good, some places not so good, but that's heavily dictated by the number of patients they have as an inflow. So they can only give so much time. A concept that therapy needs to be 45 minutes, 1 hour is not necessarily true. Sometimes you can have therapy that is shorter that can still make a difference to your life. So I think really having that conversation with your therapist or having that conversation with your doctor will help you access the help you need. What a lot of people don't do is they're not honest about it. It's still a little stigmatizing in its own way to say, oh, I can't afford it. And that's important, because you don't want to go for something to help your mental health while paying for it is affecting it conversely. Right? So honesty is something that you can always work with, and there are definite options that are available.
Okay. Another thing that I feel is that organizations, to a large extent, are also responsible for the mental health of their employees, because, employees are spending about 10 to 12 hours a day, within the organization. And a lot of pressure is due to work that they face, and once they come home, it comes out, against their family because of the work pressure and so on.
Yes.
I feel, personally, that organizations should make counselors available within the system for employees if they do need it. But do you think it's important, and how important is it?
I think it's terribly important, especially in the corporate world. Again, if you look at scientific data, you're looking at around 20 to 30% people facing potential burnout. And these are your employees, these are your valued employees. They have so much to contribute, but because of the work stress, they're tending to have a burnout, which will again affect their functioning, which will again, as a company, if you're looking at profits, will also affect that. Having a counselor in the long run will kind of help balance that, will help you pick up red flag signs on someone who's kind of having a slightly deteriorating course, and be help you able to intervene much earlier on. At the same point of time, it's also important that companies give that kind of safe space to employees who are going to counselors. What a lot of companies, and when we try to work with workshops, and people come up to us and say, oh, I don't want to go to the company psychiatrist or the counselor, because what if they report back to my boss that I'm not doing well and I lose my job? Or everyone watches when I go into that cabin, and there is a lot of gossip and a lot of interest as to what I'm going to say or what my problems are. So it's not only just the availability of a person, it's the availability of a safe space where they can talk and they can get their issues resolved without judgment. That's important to provide.
Okay. One of the other things that's happening more commonly today is more youngsters, children and teens are more affected by mental health issues, whether it's anxiety or depression and so on. What are the do's and don'ts for parents? Because a lot of times I think parents tend to ignore it. Like they just think, they're going through a phase and it's just a growing up thing and they'll get over it. So what do you suggest, parents should look for and immediately take action if they see certain things?
I think if you're when we try to work with children and adolescents who have mental health problems, we actually work a lot more with the parents, because it's the environment the child is in that really impacts a child, right? I think from the beginning we need to focus on skill building rather than just marks. So I think what has happened today is the focus on things like teamwork, from communication skills has gone down, and the focus is, oh, I got an A plus in the project, which anyway the half the time the parents themselves are making.
Yeah.
Right? We are not encouraging processes, we are not encouraging curiosity, we are not teaching our children to deal with rejection and failure. And this is a problem, because as a parent, maybe you can protect your child till the time they're maybe in class 9, but bam, when class 10 hits, your school can't protect the child, the parents can't protect the child, because that's also adolescence, there's a teenage, interest in the opposite gender or romantic interest, dealing with the world, dealing with competition. So it all tends to hit at one point of time. So I think if we start nurturing our children, helping them cope better, teaching them that rather than just focusing on how much they did or which class we should put them in, I think we kind of bring in a protective environment for them that reduces the likelihood of mental health problems. If
Right.
your child does develop a mental health problem, it's again important to acknowledge that it isn't a process of, acha kya ho gaya, I'll handle it, don't worry, it's my problem. You need to help them feel accepted. As an example, we have parents, and I hear that, telling their children, I'm disappointed that you could worry about something like that. And the child hears, I'm disappointed. And that's what stays. So the way we talk to our children is also extremely important as parents. I'm not telling them to mollycoddle them, but be aware of the impact of the words you say. If your child has drastic changes in their behavior, in their mood, in their sleep and appetite, if they've suddenly become very secretive, it's also important to talk. A lot of schools have counselors that right now. So talk to your school teachers, counselors. If you've seen a behavior change in more than one place, then it's not a bad idea to maybe take a professional opinion. At the most, what will happen, you'll find out the good news, it's all right, it's just teenage issues, and that helps you put your mind to rest. But it can prevent things from deteriorating, so talking to an expert in such a situation always helps.
Right. But now with the lockdown, kids are getting schooled online. So therefore,
Yes,
the social activity has
is
reduced
lost.
in terms of,
Yeah.
mingling with other students, going to an educational institute where they can go out and play and so on. So that also will affect them more, isn't it? How
Yeah.
can parents help them during this time, during the lockdown when they're at home?
I think children right now, so as an example, you don't have a lunch break where you can talk to your friend about a teacher who was, who was boring. You can't pass notes, which all of us have done. And that's important because you can't expect a child to look at a screen all day and have the same attention and focus without the environment around it.
Hmm.
I think as parents, we would then need to step up and also be more friends with our children, right? And bring in activities or do more fun events with them, play a little, because I think what children are missing out the most during the lockdown is play. They are
Hmm.
playing on their computers and their mobile phones, but they're not playing with individuals,
Hmm.
right? And that is something, because that's the advantage of a large Indian joint family, where you can play with your children, you can make events fun and sort of give a proxy social network. Of
Hmm.
course, that's not equivalent to what they would have in school or with their friends, but something is better than nothing in this situation.
Right. What are some of the most common problems you see with kids in your experience?
I think there are two types of problems, and both are the ends of the different ends of the spectrum. And they both really come in from emotional issues. When a child has emotional turmoil, they can either become extremely reactive, aggressive, have tantrums, become very oppositional, or they can become very withdrawn, they can become very negative, depressed, and low. Often, when we talk to the children, we form a rapport, you realize that the core is emotional turmoil that is happening. And the emotional turmoil can have multiple reasons. This is one set of issues that children have. And the second set is issues related to learning disabilities. Right. So for example, dyslexia and Tare Zameen Pe, although it I think came out more than 10 years ago, has brought that into conversation. It's still not recognized by our teachers. ADHD isn't picked up. So these children, even though they're intelligent, are having academic difficulties. And in today's day, almost everyone is being graded on an academic scale. So I think at least when I was younger, if someone got 60%, nobody cared. But today, 60% is the end of the world, right? And this child is putting in all their efforts, but isn't able to do well because of a problem that they have and being constantly judged. And that is very traumatic for the child. So
Right.
these are the two areas that I think we are seeing more and more now.
Okay. One of the things that I've been seeing a lot on social media and the discussion is especially around adults and anxiety. Because a lot of people I know, including myself, we're talking about anxiety, the issues we're facing, the inability to deal effectively with certain situations. I think probably one, maybe because of the lockdown, which has aggravated the situation. But also because I think though we're all educated, smart, intelligent, and so on, we're not able to solve the problem, so to speak, ourselves, right?
Yes.
What is the action we should take? I mean, should we seek out counseling, or is there some self-help kind of thing that we can do, to help ourselves?
So I think right now we have to remember that, especially with the pandemic happening, there is a cause for anxiety. So at one point of time, we don't want to minimize the natural anxiety that is actually helps you stay healthy, makes you take the precautions you need to, and all of that. So that is a healthy anxiety that is needed. The other anxiety that kind of takes over your day, that doesn't let you kind of switch off, is the problematic anxiety. I think again we need to first talk about things that prevent this or protect you from developing that type of anxiety. With the lockdown that came in, I think few things happened. First is the boundary line between a professional and your professional and work life got very blurred. Earlier, home was your safe space, right? A place where you could relax, where you could be yourself. That has gone out. Now, home is a place where you're stuck and is also your workplace, and also it's almost like a jail. So it kind of takes away your safe space. Secondly, older coping strategies of meeting friends, talking with them, even change of environment out, right? Thirdly, if you're looking at the news, you're trying to keep updated, it's only negativity, negativity, negativity on negativity. So all of this is going to have an impact on the mind. So being aware of the issues that can cause you anxiety. And from the things I mentioned, any of them could be more important for a person. It could be a financial stress. You're not sure whether your job is going to be there in the next 2 months. You need to know what really causes you distress. Remember that the other components are also important, and start working protectively. Make sure you're grounded. Don't let your sleep routine go for a toss. It's not okay to sleep at 4 a.m. and get up at 2 p.m. That doesn't help in any way. Eating habits, not doing your household activities at times. You have dishes piled up, it will affect you negatively. Looking at the mess does affect the person negatively. So all of these are very basic things you can do. If you begin to notice anxiety is coming in and you're finding it difficult, I think starting to withdraw from sources that are potentially toxic to you is important. For example, I really recommend that, your phone shouldn't constantly be ringing and beeping, because that kind of prevents you from switching off, which is very important, right? You need to kind of, if you want, you're feeling really lonely, schedule in calls with people you care about. Talk to them. Don't wonder whether, okay, they'll be busy or not. If they want, they'll make time for you. It's not necessary, but they will put in an effort if they know you're reaching out. And finally, if you think it's beginning to overwhelm you, start talking to a professional. Sometimes it's difficult even to talk to our closest friends or our families about our real deep fears, because we always worried we'll worry them, or B saying think that, I don't want to be judged by people who I really care about. So a professional is someone who will be able to help. There are a number of helplines that have started during this time, especially to deal with people who are having anxiety in this period. So maybe not an anxiety disorder per se, but who are having adjustment issues to this different. There are a large number of helplines that have come in, and they are able to help. So I think if you Google it, you'll find a helpline. Even you may find an helpline in your area or your language, which would make it easier for you to talk.
Okay. One important thing that I think is that it's important to exercise. To get some form of exercise, though you are at home. I don't think people are doing enough, because I've been urging my own friends, for instance, go to your terrace, at least walk for half an hour, 45 minutes, get some fresh air, So what are some of the ways in which, physical activity of some sort, whether it's yoga or even meditation, what are some ways in which we can keep our mental health, intact?
I think you very rightly said, Latha, that exercise is extremely important. Exercise is important for your body, and if you want to talk in purely in mental health terms, it helps release something called endorphins and endogenous opioids, which are very important for your mental health and a good mood, so to speak. So getting that routine in is important. And it's not that if I've exercised today, I'll be in a good mood today. It kind of builds up over time. And I think that's important to realize, that it's not an instantaneous fix or a high. That's not what we are expecting. At the same point of time, when you're at home, I know it's difficult for some people. Some people they're not allowing walks in the building. They're not allowing people, but there is equipment in your house. People who can't go to the gym can lift 1 kg rice bags, right? So there is enough in your home to include into your exercise routine. A lot of apps nowadays are kind of giving sessions where you can see people online and work out as if in a gym. Sometimes what we do, we also encourage our patients to have a fitness challenge with friends. So you kind of feel connected, you're doing something together that keeps you motivated, and it kind of gets you to a goal. So 21-day fitness challenge or 10 Surya Namaskars or something. So it kind of builds that connect, and that's something you can do at home. But yes, exercise overall for mental health is very important. I'd just like to mention, because you talked about meditation. Meditation is a fantastic tool if the mind is calm or in early stages of anxiety. When it's severe, meditation is often difficult to practice, and that can bring in a lot of frustration in the individual, because they're trying to do something and they're not able to do it. So if you're not able to do it, don't push yourself unnecessarily because someone has said meditation karo theek ho jao. Right? Yeah. Listen to your body, listen to your mind, help it heal. Right? You would be different from someone else. So let us listen to ourselves better.
I agree with you on that bit, because, a lot of people tend to give you so much advice, and you tend to listen to everybody, and you're like, you get confused. But I think it's so important, like even when I exercise, as an example, I don't push my body beyond a certain limit, because I feel, though the trainer might say, oh, you can do it, I'm worried that I might overdo it and something goes wrong. So wouldn't you say that it's important to listen to yourself first before you start listening to everybody else?
Yes, and I think it's important because your body gives you feedback. And secondly, I think again, you really need to know what you're exercising for. If you're trying to get into bodybuilding competitions and you really want the biggest muscles there, well, that's a different conversation. But if you're exercising for health, it's important to remember that sustainability is important. 2 days workout and then 5 days kind of, recovering from sore muscles is not going to help anyone. You need to focus on sustainability, what I can do, what I cannot do, and finally trust yourself. Right? Your body knows you. Trust yourself. If your trainer is pushing you, someone is pushing you, talk to them. There's no harm taking an opinion, but an opinion is not something that is a fact, right? So listen to them. It's important, but make your own decisions.
Right. I know you are a psychiatrist, but I do want to ask you this. In terms of food, does that also affect mental health, like what you eat?
So food is important in its own way. There is a lot of research that goes into certain foods that increase blood serotonin levels. There is research that goes into vegetarian versus non-vegetarian diets, the Indian, the homeopathic or Ayurvedic sattvic diets that people talk about. Food does play a role, but in terms of, if you talk about general, you're not looking at things that are very high in sodium. So a lot of the processed food really tends to have negative effects on your body. Your brain is an organ that isn't divorced from your body. It exists in the same shell. So if you're anything that's bad for your body is generally bad for your mental health, is a dictum that we should keep. So processed foods are a problem. Fruits are always good. Too much of alcohol or other drugs are a major issue when it comes to mental and physical health. So keeping this in mind is important.
Okay. Okay. And my last question to you, post-COVID, I mean, once all this is over, what should people do to kind of, get back into normal routines?
I think the good part of COVID has been making us realize what really matters. Our health, our family. So I think when we get back, the work-life balance is something that I think people should prioritize. I am afraid that people are going to want to get back and say, oh, now I have to put in extra hours because I have to let my boss like me because I could get laid off. Right. Or we have to make up time that we have lost and forget all about that, that all the webinars and conversations that have happened about work-life balance, but prioritizing what matters to you. Prioritizing what matters to people you care about is something that we should always keep in mind. It is going to be difficult to reset a routine. That can always happen, but remember what you're here for. Keep that in mind.
Okay, great. Thank you so much, Dr. Natasha, for your tips. And I think you gave us some great points. And I hope parents, especially, start looking at their kids and spending more time with them rather than just giving the gadgets and, trying to get them out of their way. And I think mental health, like I mentioned at the beginning, is an important topic. And I hope, this video starts a conversation and, gets more people engaged. Thank you so much.
Thank you so much. Nice talking to you, Latha. Great.